Hey man, take a breath. I'm Dr. James, your friend and guide, a physician-scientist with more than 20 years of experience. Let's be honest, most men don't talk about HIV or AIDS until it hits someone close. But what if the first signs were already in your body right now, just masked as tiredness, a stubborn sore throat, or stress? According to the latest 2025 CDC data, men make up about 81% of new HIV diagnoses in the U.S., and ages 25 to 34 carry nearly 37% of that load. That's roughly 13.7 per 100,000 people, with over 31,800 new cases recorded in 2022, a 12% drop since 2018, yet still a loud warning sign. Here's the catch. Feeling healthy does not equal being safe. HIV is like a silent program running in the background, slowly draining your immune defense until AIDS takes control. In this video, you'll discover 1. The core science of how HIV attacks your CD4 cells. 2. The 5 clusters of early symptoms most men mistake for something else. And 3. The 60-second scan and testing plan 60 to 6 to 3 you can start tonight. If you feel this conversation matters, subscribe and comment 9 to join the men who care about their health. And don't skip the ending, because that's where I'll share a practical secret you can use at home to boost immunity, stay ahead of symptoms, and stay confident even when your partner is at risk. Now, let's unpack how HIV actually moves inside your system. Hey guys, don't scroll past this part. Give me a few minutes so I can update you clearly, because the first thing I need you to understand is simple. HIV is not the same as AIDS. HIV targets CD4 plus immune cells. On its surface, a protein called GP120 locks onto CD4 and then a co-receptor, usually CCR5 or CXCR4, to slip inside the cell and take control. HIV is a retrovirus. It uses reverse transcriptase to copy its RNA into DNA, forms a proviral blueprint, and integrates that DNA into your own DNA so it can reactivate and manufacture more virus later. Clinically, there are 3 big stages. Acute infection often looks like the flu: fever, sore throat, swollen lymph nodes, and fatigue that doesn't match your day. Chronic infection can feel quiet while HIV keeps working, and your CD4 count gradually falls. AIDS is when CD4 200, so opportunistic infections and tumors like Kaposi sarcoma can appear, along with diarrhea and unintentional weight loss. Think of your immune system as a fire department. HIV isn't the fire, it's the saboteur who loosens the water valve. When a blaze flares up elsewhere, water still comes out, but pressure is dropping every week because the valve has been quietly leaking. Now, a 2025 reality check without scare tactics. Incidence has been trending down in the long term, which is good, but diagnoses remain concentrated in men, especially ages 25 to 34, with heavy impact across parts of the American South. That pattern matters because it tells us where the blind spots live. If you've ever felt basically fine but something is off, the next section will show you 4 root causes that hide early signs. And drop a quick comment, "Me too," if stress from work or family sometimes blurs your body's signals. I get it, and you're not alone. Stay with me, breathe steadily, and I'll guide you from the roots to the blind spots so you can finally see what others miss. Meet Peter, age 27, a night shift IT engineer. He came to me with months of fatigue and recurrent sore throats, all bacterial tests negative, and a nagging sense that something deeper wasn't right. Hey guys, what you're about to hear really matters. When you understand the root causes, HIV and AIDS can be challenged at the source. Use these insights to protect your energy, confidence, and prime years. First, stress and high cortisol. Chronic pressure from work, money, or relationships pushes cortisol up, quietly bending the immune system out of shape. Sleep gets shallow. Inflammation rises, and the body's early warnings blur into the background like static on a radio. Second, loss of deep REM sleep. You can spend 7 hours in bed and still miss the phases that reset immunity and brain signaling. Without REM, your recovery lags, your pain threshold shifts, and those subtle flags, like night sweats or sore throat, feel easy to dismiss. Third, sitting too much and moving too little. Long hours at a desk slow lymph flow the highway immune cells use. Circulation drops, lymph nodes may react silently, and the signals to notice get trapped in low traffic. Fourth, false reassurance. We tell ourselves, it's just a cold, just allergies, and delay the test that could bring clarity. Waiting turns days into weeks, and weeks into blind spots where risk can grow without a sound. Let's make it real with Peter, 27, a night shift IT engineer. He naps in fragments, calls last week's fever just a bug, has mouth ulcers, and wakes soaked at 3 a.m. He blames the weather, powers through a double shift, and misses the message his body is sending. Here's the truth. This is not age catching up with you. It's a lost connection between you and your body's signals. If anything here feels familiar, tell me in the comments. I'll point you to next steps, resources, and testing timelines that respect privacy and move you forward. We rarely see the quiet stuff until it truly costs us. Where are the blind spots hiding? You're about to see the concealed mechanism most men overlook. We're entering the secret zone, the way HIV erodes CD4, and how to spot the leak before the fire gets big. Hey guys, this part is about you, the blind zone I keep seeing in real patients. Do you fall into the group that doesn't recognize it? Stay with me, and by the end you'll feel confident that you truly understand the mechanism. The goal is not to scare you, but to make patterns visible and actionable. First, the lymph nodes. Groin, neck, and underjaw nodes can swell quietly for more than 4 weeks, then shrink, then swell again. That on-off behavior makes men shrug and wait, even when the pattern is precisely the clue we need. Second, the mouth. Recurrent mouth ulcers, or a creamy tongue coating, point to mucosal immune stress. They flare, fade, and return after late nights or a cold. Easy to blame on weather, spicy food, or a rushed week. Third, the skin. Faint pink or coppery macules can appear and vanish in days. Because they are not dramatic or itchy, they never make it into a calendar or a clinic visit, yet they mark systemic inflammation. Fourth, the autonomic system, your body's thermostat and wiring. Sleep breaks for no reason, dreams vanish, and you wake damp at 3 a.m. with night sweats. Heart rate feels a notch faster after coffee, and your stress fuse gets strangely short. Think of an electrical cable with a tiny nick in the insulation. There is no flame today, only a quiet leak of current that weakens the whole circuit. That is how slow immune erosion feels from the inside. Peter again. His angle of jaw node grows and shrinks, he wakes soaked twice a week, and he has dropped 7 pounds in 2 months. He calls it overtime and weather, but the pattern says otherwise. If you want to stay ahead of symptoms, write down these checkpoints in a notes app tonight. If anything here feels unclear, tell me directly in the comments so I can refine the next lesson. It's time to act. The 60-second nightly ritual, the 60 to 6-3 testing timeline, and the promised secret you can start at home today. Congratulations for making it here, guys! Grab a pen because in the next 60 seconds you'll get a tool many men wish they had sooner. I'm right here with you, and we're going to keep this simple, practical, and doable every night. C. 15 seconds. Face a mirror and quickly check mouth, skin, and eyes. Look for mouth ulcers, thrush, or any unfamiliar rash or discoloration. Turn your head side to side. Note anything new, even if it seems tiny or easy to ignore. Sense. 20 seconds. Ask yourself 3 questions. Did I sweat through the night last night? Is my throat still scratchy or sore today? Am I carrying a tired, heavy feeling that lingers past coffee and a normal workday? Be honest. This is just for you. Scan. 25 seconds. Gently feel along the neck and groin for lymph nodes, then jot a 1-line note on sleep and weight. Consistency matters more than perfection. The record is what turns hunches into patterns you can act on. Testing timeline, the 60-6-3 plan. If exposure is possible within 72 hours, go to urgent care or ED and ask about PEP in line with current CDC guidance. From day 0 through 6 weeks, prioritize 4th-generation antigen-antibody testing. Between weeks 2 and 3, consider RNA testing if a risk is high or anxiety is overwhelming. At month 3, repeat testing to confirm your status. This information is educational. It never replaces a personal medical evaluation or doctor-patient advice. Prevention that fits real life. Use condoms every time, and discuss PrEP if your risk is ongoing. A 2025 update expanded options with long-acting choices for people who struggle with daily pills. Ask a clinician which regimen matches your lifestyle and medical history. Peter's practice run. For 7 nights he did C-Sense scan, logged sweats and a jawline node, then got a 4th-gen test and counseling on PEP or PrEP based on risk. The routine calmed the guesswork and gave him a clear next step. Reply, secret, as promised. Pair the nightly ritual with a simple morning habit. A glass of warm water with honey, then 20 to 30 minutes of cardio daily. Hydration and steady aerobic work support sleep quality, mood, and immune balance. This is not a cure or a substitute for PEP, PrEP, condoms, or testing. It is the foundation that makes those medical tools work better in real life. If this helps, comment "Tout voi." If not, drop 0 so I can improve the next lesson. Next, I'll explain why the 60-second ritual and the 60-6-3 plan work at the cellular level so you can feel confident. And yes, you might still feel skeptical. Here's the science that makes this approach trustworthy. Stick with me through this part because when you see the why, you'll know why these steps belong in your life starting tonight, guys. Active tracking shifts you from guessing to detecting patterns early. By logging nodes, mouth ulcers, skin changes, and night sweats, you create a baseline. When a cluster repeats, it stands out, turning vague worries into actionable signals you can bring to a clinician. Awareness lowers cortisol. When your brain understands what to watch, uncertainty shrinks. Cortisol follows and sleep architecture improves. More slow wave and REM. Better memory consolidation. Steadier autonomic tone. Lower stress hormones mean less background inflammation and clearer immune communication. Timing is everything with tests. Using the 60-6-3 window aligns with known diagnostic performance. 4th-generation antigen-antibody tests catch early P24 antigen. RNA testing fills the early gap. Month 3 confirmation reduces false negatives. The right test at the right time shortens the period of uncertainty. Prevention works when it fits real life. Long-acting PrEP options raise adherence for men who struggle with daily pills, while condoms keep barrier protection simple. If infection is diagnosed, prompt antiretroviral therapy can suppress viral load to undetectable, and UHU means no sexual transmission. Peter shows the arc. He tested on schedule, negative at the first checkpoint, and got counseling on PrEP suited to shift work. With a nightly ritual, his sleep deepened, morning energy returned, and those twice-weekly night sweats faded. Here's the bigger picture. Systems respond to steady inputs. A small, repeatable practice plus time-correct testing reduces noise, restores confidence, and gets you to treatment faster if you ever need it. That is why this method holds up under pressure, not just on good days. As you stabilize, the benefits don't stay in one lane. They ripple through mood, focus, fitness, and relationships. If you're already feeling better, share this with someone you love because clarity is contagious. Now, let's trace those ripple effects so you can see how small wins stack into durable change. I'm not here to be poetic. I'm here to be useful, and you'll see the changes below, day by day, in ways you can feel. That is exactly what I want for you and for the men you love. So listen closely, because small disciplines compound into visible wins daily. First, your sleep runs deeper, with fewer awakenings and steadier REM, so mornings feel lighter, focus returns sooner, and caffeine becomes optional instead of mandatory. Second, mucosal health stabilizes. Mouth ulcers fade, oral thrush recedes, and the random rashes stop popping up because inflammation is finally being dialed down gently. Third, mood steadies. Worry shrinks as uncertainty shrinks, and the energy you used for fear returns as motivation to move, stretch, and lift body space. Fourth, conversations with partners get easier because you bring clarity instead of vague worry, and safety plans become shared plans, not accusations, pressure, or silence. Think of it like retuning a drum line. Once the tempo settles, every instrument in the band, every system in your body begins to land together. Peter returned at 6 weeks with steadier sleep, less anxiety, and a healthier routine. Workouts felt sustainable, appetite normalized, and BMI slid into comfortable range. These ripple effects are not magic. They follow when steady inputs recalibrate hormones, circadian rhythms, and immune signaling, giving your system the margin needed along. When you start feeling that steady rhythm under daily life, confidence returns step by step, and the panic has less space to rehearse your head. If you're seeing positives already, drop a comment reading "Titkuk," because encouragement multiplies quickly, especially for men who are starting treatment or rebuilding routines. Bridge to the layer ahead. We've touched emotions and identity, and in 60 seconds, I'll show you the picture once these habits lock into place. I'll say this plainly, because it matters to men. Confidence is non-negotiable, and it's the first gift I want for you. We rebuild it by moving from disconnection to action, scanning your body, speaking clearly, testing on time, and using PrEP when appropriate. That shift changes how you feel in a room. Instead of waiting for fear to decide, you bring a plan. The nightly check, the testing timeline, and honest conversations. You stop bracing for impact and start steering. One measured breath at a time, with facts on your side. In real life, that plan touches love and daily living. You explain safety, boundaries, and testing cadence without drama. You ask for consent and give it. Your partner hears clarity instead of worry, and trust rises because your words match your consistent actions across weeks. Think of it as a second springtime. Energy returns in quiet ways. Sleep evens out, food tastes right, workouts feel sustainable, and your temper shortens its fuse less often. You're not being pulled by panic anymore. You're choosing direction, time, and pace with a steady hand. Peter closes the loop. He went from alarm to practice to calm control, notes in his phone, tests on schedule, and candid talks with his partner. He didn't chase perfection. He built reliability. That's what adult confidence looks like. Small, repeatable steps that add up. Open your notes and check what you logged this week. Sleep, sweats, throat, nodes. If you missed days, start fresh tonight. Drop a quick comment, "Saved it," so I know you've got your list and you're ready to run it. You are not alone, together, forward. We'll wrap everything in 300 words, clear, concise, and usable, so you can keep momentum with zero confusion tomorrow. Thank you for staying with me to this point. Your attention is real fuel for this work, and if anything felt unclear, leave a comment and I'll clarify it for you. Here is the short, usable wrap-up you can act on tonight. HIV is not AIDS. HIV quietly lowers CD4 across 3 stages: acute, chronic, then AIDS. Early signs often mimic colds or stress: lymph nodes over 4 weeks, mouth ulcers, thrush, night sweats, and unintended weight loss. Do the 60-second C-Sense scan nightly. Follow the 60 to 6-3 testing timeline. Seek PEP within 72 hours. Consider PrEP, including twice-yearly options. Remember you with effective treatment. And keep my secret tip in play. Expect ripple gains, deeper sleep, steadier mood, safer conversations, and a durable return of confidence. Tonight, Give yourself 60 seconds. Run, see, sense, scan, and write a single line in your notes. Tomorrow, book appropriate testing, and if risk exists, visit a clinic for personalized guidance on PEP or PrEP. If you want weekly practice sessions, subscribe and comment "Ready." Share this video with one person who could use less fear and more clarity. I'm grateful you made it to the end. Next week, I'll release a 7-day checklist you can follow step by step, with reminders, examples, and time-saving templates. Final reminder: nothing here replaces individualized medical care. Use this as your action map, then talk to a qualified clinician who knows your history, medications, and risks. Precision plus consistency will protect your future. Before you close the app, breathe in, roll your shoulders back, and decide on your first micro step. Save the notes template, set a nightly alarm, or send this to a friend. Small moves repeated build the strongest shield. Until then, take care of your body, respect your partners, and lead with calm, informed courage. Every day forward.